One of them, talking to Fabiana and Guillermo yesterday, we learned that Brazil has a law, I don't know if it's a law or rule, about the number of hours pediatric residents can work. They were explaining to me how this law is not always enforced, but the law exists. I can tell you that globally, not just in Brazil, not just in the United States, but globally, the trend is for there to be some type of control over the amount of hours trainees, and that includes residents, should work. That is a global trend, not just in the United States, not just in Brazil. And that limitation on work hours that is going to exist in the future is going to need somebody to fill the gap. And so pediatric hospitalists in the United States have filled some of those gaps. Hospitals focus a lot on quality in the United States. They need a lot of patient turnover. They need, when the patient is in the hospital, for unnecessary procedures to not be done. They need cost to be limited because we work with insurance companies. We work with third-payer providers. That is another global trend. So if in Brazil, insurance companies or even government-run insurance companies is not a big part of the system, I can guarantee you it will be. And I'm sure you have something very similar. The third-party payees are going to become the standard in lots of places. And direct payment to doctors is going to be less and less and less. And so hospitals are very interested in keeping costs down, and that's a global trend as well. So that's exactly what I'm talking about here, is that economic pressures. In other words, managed care in which a insurance company is just paying a certain amount for a certain condition is very important for the cost to be down. And in general, pediatric hospitalists and certainly adult hospitalists have been shown to keep costs down. So where are we right now? Currently, we're not a board-certified specialty anywhere. Not in the United States, and I don't know of anyone who has a board certification in either adult hospital medicine or in pediatric hospital medicine. The adults have decided that the way they're going to recognize a hospitalist is on their internal medicine boards. They're going to have a special focus, and so a lot of their questions are going to be related to hospital care. And when they renew their internal medicine board, they're going to have a special sticker or a special recognition that says "Focus on hospital medicine." In pediatrics, we haven't decided what we're going to do yet, if anything. But an exploratory committee was set up last year to explore this issue. And they're going to come up, they have representatives from the whole of pediatric hospital medicine. I'm a member of this committee. And basically a report is going to be generated that's going to tell the leaders in the field what the pediatric hospital medicine community wants to do. Do they want to become a board specialty? Do they just want to have a special recognition like the adults? Or do they not want to do anything and want to stay the way they are? That's not an answered question yet, but we'll see. So what about the history of hospital medicine in general? Well, Dr. Robert Wachter, like I said before, was probably the father of hospital medicine. He was the first one ever to use the term hospitalist in this New England Journal of Medicine editorial that he wrote back in 1996. And his university was the first one to really establish the first modern hospital medicine model where the hospital medicine was a separate section from internal medicine. The first organized society was actually originally named the National Association of Inpatient Physicians. It was founded shortly after the article in 1997, and now it's called the Society of Hospital Medicine. And they by far represent the most number of hospitalists, and pediatricians actually represent about 10% of the hospitalists that are represented in the Society of Hospital Medicine. But for pediatricians, the largest section or the largest representative organization, is the American Academy of Pediatrics. And the American Academy of Pediatrics has a section of hospital medicine. The American Academy of Pediatrics, it's divided into sections. The section of infectious disease, the section of pulmonology, etc. And we have the section of hospital medicine, which was established in 1999. And our current membership just, and when I say just, I mean this month, just hit 1,000 members. The first National Pediatric Hospital Medicine was held in San Antonio, Texas in 2006. And we've had a National Pediatric Hospital Medicine for every year after 2006. Last meeting that we had was actually in Kansas City, and there were more than 520 attendees. In 2008, the Pediatric Hospital Medicine Roundtable was set up, and it's a group of leaders within pediatric hospital medicine that was given the task of deciding what the future of pediatric hospital medicine looks like. And they also have several initiatives, quality initiatives, safety initiatives to improve safety in the hospital, quality in the hospital. But the leadership of hospital medicine is really comprised of three organizations of pediatric hospital medicine. The Society of Hospital Medicine, which has about 10% of its members who are pediatricians. The American Academy of Pediatrics, which really is the largest organization. And the Academic Pediatric Association, which is a special interest group within it that's hospitals pediatrics. And when we have a national meeting, one of these organizations takes the lead. Every year they take turns in deciding, and they are the leaders for that meeting every year. And that's the model that we've had so far. And just this year, a joint council of pediatric hospital medicine was convened in which representatives from each of these three organizations sit on this council to make sure that we're all playing by the same rules and that the interests of all the different organizations are taken into account. So what does Society of Hospital Medicine do? Well, most of its members are adult. About 10% are pediatrics, but pediatricians sit on all the committees. So we do have a voice within that organization. And really, the adults have been the pioneers in hospital medicine. They were the first to have competencies published, like this is the knowledge that a hospitalist should have. They were the first one to have an official recognition, and they were the first to set up a lot of resources that hospitalists can use. The American Academy of Pediatrics section of hospital medicine is by far the one that represents the most number of pediatric hospitalists. It was approved back in 1999. Like I said, its membership exceeds 1,000, and it is the fastest growing section within the AAP. We're projecting that probably in a couple more years, we'll probably have more than 2,000 members, which would make us one of the largest three sections in the American Academy of Pediatrics. And we have very close relationship with the other two organizations. The section has a lot of subcommittees of different hospitalists who are very interested in very different things. Gita is in this committee. I'm in this committee. And soon to be the international subcommittee, in which I hope Fabiana and other pediatricians from Brazil who are interested will be part of this subcommittee. The Academic Pediatric Association really is focused on research and education. They work closely with the other two organizations, and at their meeting, they have a special section for hospitalists to present their work.